So I'm just going to get myself set up down here for a second. Okay, so I'm presenting today on the impacts of the COVID-19 pandemic on the health and well-being of educators in the Yukon. And I'm doing so on behalf of Dr. Chrisman and our team at Enhancing the Prevention of Injury and Disability at Work Research Institute, which I'm going to call EPID at Work from now on, which is housed at Lakehead University in Thunder Bay. But I think it's really important to introduce myself in relation to this work. Because if others have mentioned, and you may assume, this is a researcher-led project, but I am based in the Yukon. My name is Dana Corton. I am a PhD candidate in health sciences at Lakehead University, but I've been doing so from a distance. So I have been living, working, and learning on the traditional territories of Selkirk First Nation, which is in Pelly Crossing, since 2014. I am a partner to a Yukon educator, and I am a mother to a school-aged kid. So for this project, I was part of a team with a bunch of settler scholars who live in many different locations across what is now known as Canada as uninvited guests on the traditional lands of many Indigenous peoples. So we think it's important to first recognize the efforts to displace and disconnect Indigenous peoples from their land and strive to challenge and showcase that we strive to challenge those efforts while advocating for the sovereignty and self-determination of these nations. And why does this matter? I think it's important to openly declare this position first to situate the knowledge that I'm bringing forth today. My background and my experiences inform the perspectives I bring to the work, which includes the interpretation of the findings that I will be presenting on behalf of our team. So here's an overview of what I'll be covering. The project is pretty comprehensive, have a lot to go through, but I'm going to move quite quickly. First, I'll provide some background and context, then explain our approach to inquiry, which includes our methods and a description of our participants. Then I'll explain and discuss our key findings, connect it all via a schematic model, which is the visual piece, and then conclude with ways to move this work forward. Okay, so as most of us know, in the early stages of the pandemic, there were significant changes to the delivery of K-12 education. There were federal and territorial mandates, which the Department of Education responded to, resulting in schools' adapted operations. This included the suspension of in-person learning temporarily, and then new and enhanced health and safety measures upon return to school. Educators were forced to navigate a number of very sudden and evolving changes. So we as a team recognized the need to understand and highlight these lived experiences. So we explored the question, how has the COVID-19 pandemic and associated changes to the delivery of education impacted health and well-being of K-12 educators within the territory? So the overarching objectives were these three: to first provide foundational insight into the effects on all dimensions of health, understand educators' experiences and perceptions navigating different stages of the pandemic, and then provide evidence to help inform decisions moving forward. Specifically for this, we sought the support and guidance with various aspects of our project from the Yukon Association of Education Professionals, the Yukon First Nation Education Directorate, and the Yukon's Department of Education through the Assistant Deputy Minister's Office. So this was our approach to inquiry. The research process was informed and supported by the aforementioned advisors. The study was primarily qualitative in nature, but again, I'm leaning heavily on those who spoke before me that this was not the only portion of our project. We followed a critical grounded theory methodology with the bulk of our data being generated from in-depth semi-structured interviews with educators across the territory. We completed a collaborative thematic analysis with an iterative coding matrix, open and axial coding, and then some manual functions within NVivo to refine these approaches. So this analysis led us to the development of a conceptual schematic model to connect these themes that emerged from our work. I'm pretty passionate about less conventional methodologies, so please come talk to me if you want more information about our research instruments or data collection, analysis procedures, stuff like that. Okay, there's a lot of information on this slide, but the main points are that we used a very purposeful sampling strategy. So leaning heavy in intersectionality theory, we wanted to intentionally interview eligible participants based on characteristics we are hoping to capture. So we wanted to ensure traditionally marginalized voices were represented, or in other words, that our sample had enough variation. So we interviewed 37 educators with a nearly 50-50 split between those in rural locations and those based in Whitehorse. The majority were female, but we also had male and non-binary participants. Some of our participants identified as part of the S+ community, and some also identified as Indigenous, 10%, and 24% for the other category. We found it to be really challenging, though, to categorize these roles and these experiences of educators within the school in a really discrete way to make some of these comparisons. Many people wore different hats. So we landed on the idea of categorizing by their main role. So you can see at the bottom, our sample included elementary and high school teachers, educational assistants, and principals or vice principals with a range of years working for Yukon Education. I'm gonna move on. Okay, so when answering our research question, these three themes emerged from the interviews, and I'm gonna go through these in a lot of detail in a second. So the first is differential effects on health and well-being, specific challenges navigating different stages of the pandemic, and then the circumstances that mitigated or moderated adversities. So please remember, this is a high-level overview. Again, there's a lot of detail and nuance that's missed, but not surprisingly, all dimensions of health and well-being continued to suffer throughout the pandemic. There were significant adverse effects on cognitive and emotional well-being, including challenges contending with job-related uncertainty and concerns with the quality of education they were able to deliver. So one participant spoke to being super stressed and grumpy with these evolving procedures. Another noted that it was really hard to maintain the quality of their program, which affected various dimensions of their well-being. There was diminished social connection and a sense of belonging related to physical isolation, loneliness, and severed relationships. Or this participant described the adverse shifts in social dynamics and their relationships. In addition, participants spoke about the pandemic exacerbating mental health concerns and negatively influencing their responses to work-related stressors. Importantly, most educators proclaimed to be burnt out, so they described physical and emotional exhaustion, cynicism and withdrawal, and impaired functioning in their professional and personal lives, also with poor morale and inefficiency. This was exacerbated for those, exacerbated for those assuming caregiving and teaching roles at home, or as one participant pointedly noted, we're all just running on empty. Everyone is struggling. Another participant gave an example of a check-in activity that was done at a staff meeting where everyone had to describe their mood in one word. And they noted that it was deflated, exhausted, hopeless, which essentially is burnout. I must also note, though, that conversely, there were a number of educators who reported very positive effects on their mental health and well-being, specifically during the period of at-home learning. So this was related to different coping mechanisms that were available within their home that was not available within their schools. And it was also related to prolonged connections with household members who they didn't often get to spend as much time with. Okay, for the second main theme, I want to describe the key challenges educators faced. So this slide is really to emphasize the complexity or the nestedness of these happenings across different scales, even though they're experienced at the individual level. So lived experiences were within the context of schools' adapted operations, which were highly dependent on the Department of Education's responses to territorial mandates and guidelines and federal ones. And then these happenings were informed by formal governance processes, which was influenced by global level events and politics. So from this, here are the 5 main challenges. Heightened and prolonged stress, levels of stress and fear within and beyond the workplace, changes to the physical, social, and psychological workplace environment, new or evolving means of delivering education, and shifting cultures and climates of the school. There are also altered perceptions and uncertainty with these evolving rules and responsibilities. And educators had to contend with these decision-making processes that affected their own autonomy and how they were able to deliver their educational programming. There was also a perceived lack of resources that were available or accessible. So this is both in terms of mental health supports and resources to adjust educational programming. Okay, so I'm gonna click through a number of quotes right now, so you don't need to read them all in detail. I'm gonna link them all together. So these showcase the stress, the heaviness or burden that they carried, with educators being pulled away from their regular job duties and getting shuffled around. This shifting teaching experience from curriculum to attending to students' more social and emotional needs. And all of this emphasized that there were different values and cultures between high-level decision makers and educators with, and I quote, boots on the ground. This forced educators to adapt day to day and, like we've heard before, recognize some of the cracks, and I quote, or vulnerabilities within the education system that have been exacerbated by the pandemic. So things like staff shortages and contending with heavy workloads, where, and I'm going to quote again, everyone is just trying their best. Okay, so this last theme is the circumstances that mitigated or moderated adversities. So antecedent or these pre-existing conditions determined the exposure to and the severity of adverse effects on health and well-being. And we broke it down into the three most relevant components. So the first are individual characteristics, which are all of the factors that combine to create one's unique identity and position within society. So this kind of extends the notion of intersectionality with a focus really on, thank you, really on the workplace environment. So it includes gender, race, social class, health status and lifestyle, job position, and geographical location, among many others. The other two are more self-explanatory, and I'll dive into them in a second, which is work environment and school culture and climate. So the circumstances also altered educators' perceptions and attributed meaning to their own lived experience. So specifically, the individual characteristics that I just described affected how capacities and proficiencies were perceived within their workplace. So things like someone who identified as resilient or having established mechanisms to deal with stress. So the work environment itself influenced perceived roles and responsibilities, which affected work duties and their connections with others. So this was done through different policies, resources, leadership, so all of those concrete, tangible things. The school's climate is focused all on explicit behaviors, so actions and strategies. And this is combined with school's culture, which is a more longer-term kind of collective attitude or values and beliefs, which together establish the day-to-day practices and also the atmosphere of the school environment. So to give a more concrete example, because I know this is really abstract, is this common circumstance from the perspective of a teacher was the role of their administrators. So those who had strong trusting relationships with their principals or vice principals, or those who felt like they were included within school-related decision-making, felt like they had more autonomy and flexibility with their adjustments and contributed to their sense of value and belonging. So I'm going to provide a super quick overview, kind of what I already described within a visual schematic model that offers an attempt to unravel some of these connections between the themes. Okay, so the impacts and the challenges of the pandemic perceived by educators were dependent on these pre-existing conditions. There is also a myriad of factors affected by COVID-19 related changes, which again were nested within these different scales. These two things combined contribute to both differential effects on health and well-being, which overlapped and intersected in complex ways with one's perceptions and attributed meaning to the experience. So these are the motivations, intentions, and expectations of the individual. I also want to acknowledge pervasive societal norms, and this is all in our big report, which goes into a lot more detail, but I'm not going to. So I want to go into moving forward is 4 key recommendations that we heard from our participants. So this embodies this idea of amplifying their voices and not necessarily linked to existing literature for the purpose of this presentation. So it's 1, to involve educators in decision-making processes, 2, improve the structures and support for educators' health and well-being, 3, to promote and maintain a positive school culture and climate, and to prioritize long-term planning and preparedness. So as one participant eloquently recommended, decision makers need to ensure that there are consistent and accountable systems in place to, and I quote, take care of human resources, which they believe will have a cascade of positive effects in all different realms. Another concisely stated, again I quote, the impacts of decisions go beyond politics to people. It needs to be clear, consistent, compassionate. Words are not enough. So hopefully I've demonstrated a discerning and comprehensive understanding of the impacts on educators. And by amplifying the voices of educators within this study, we hope to inform crisis and workplace health-related decisions moving forward. My last thing I want to leave you with is a thought-provoking quote that really resonated with me, and I'm just gonna read it. So, we must be really conscious of what long-term trauma looks like. How do we make sure that people are being taken care of in all aspects of their life? So if we're going to preach self-care, what's going to be done to ensure that everybody is actually healthy? Okay, thank you, Mussy Cho. Here's my team, which they're all amazing. They all played different roles. And if you want more information, talk to me or talk to Vicki. So that's it.
That was great. That was a lot of information in 50 minutes, everyone. Really appreciate everyone for sticking to the time.